This is the supine to sit test. This is a test for innominate anterior or posterior rotation, basically an asymmetry from right to left of innominate. In the supine position, if, let's use the right innominate as an example, if the right innominate is in anterior rotation relative to the left, the right leg will be functionally longer. Because of the relationship of the hip to the SI joint, when we sit up, so in long sitting, that same anterior rotation will now cause the leg to be functionally shorter. So the test is looking for a leg length discrepancy in supine that changes and becomes opposite in sitting. So it looks like this. Lay supine. So I'm going to test the patient's leg length by first getting her to just do a bridge and come on back down. And from that position, I'm just going to straighten her legs out and give a little even pull. From that position, I'm going to look at her medial malleoli, and I usually will put my thumbs just at the bottom of the malleoli and look straight above them. And I look for a leg length discrepancy. Let's say that the right leg is a little bit longer. And then I ask my patient to sit straight up. Come on up. And from that position, I look once again, and exact same position, and I look for a change in leg length. If that right leg is now shorter, that's a positive test for either a right anterior innominate or a left posterior innominate. And you can't tell from this test. Problems with this test is the fact that you have a patient with low back pain and you're asking them to go from a supine to long sit position. So that's an important consideration whether or not you should do this test.